Welcome back to our series, in which we reach the video about sales and marketing techniques. Since iHero is an innovative, novel solution for vision training, it is important to communicate it clearly to your patients. To help you with that, we work with our long-standing providers who onboarded hundreds of patients already and prepared a couple of handy suggestions. Since the core selling point of iHero is that it is fun and engaging, the best thing to do is to have iHero installed on your office computer or a tablet, and give a candidate for iHero a short play of a game or two. Since parents, used to daily struggles with daily vision training homework, will see their child enjoy iHero, it is an immediate and easy sell. When you also present all the benefits that will happen by doing vision training, it will be hard for them to reject. We all know that 80% of knowledge in schools is delivered through vision, so the academic benefits are clear. On top of that, we are preventing the problems from developing further if we catch and treat them early enough. They tend to get worse with age if left untreated. One important thing is also to consider different circumstances in which iHero can greatly help your patient's improvements. There are 4 main cases in which our partners are currently prescribing iHero and are seeing great results. Firstly, they are prescribing it as a vision training homework for patients to use in parallel to their in-office vision training sessions. Secondly, we hear that specialists are prescribing iHero also when the patient either has too poor visual acuity to warrant an in-office intervention, or when their visual acuity is just slightly decreased, making an in-office intervention not needed. In this way, you can give your patient something to do at home if it does not make sense for you and them to be coming to the office regularly. Thirdly, our providers are seeing amazing results with the patients with any form of binocular problems, as we utilize binocular training in all our activities. Think about any vergence problems, accommodative problems, problems reading, eye tracking, and others. iHero is a great fit. Lastly, there is a growing number of specialists who are actively having their patients use iHero as a pre- or post-strabismus surgery. Think of it as a form of physio. All in all, we firmly believe that making kids engaged and compliant is a crucial missing piece in vision training homework. However, you need to stress to the parents that while it is a vision training through games, it is still, first and foremost, a training. Additionally, because the goal is to help you build a lifelong bond with the patient's families, we encourage you to help them stay realistic. While iHero is providing amazing results, it is not a magic potion that would deliver the solution overnight. Therefore, we suggest that you prescribe iHero to patients that can realistically expect improvements. It should not be a last resort solution.